So good afternoon, everyone, and welcome to the final seminar of this semester's Health Sciences Talk series. And we're very pleased to close the term with a session of really strategic importance for AUB, featuring the Central Administration of Statistics, Lebanon's official body for national data. And it's my pleasure to introduce our speaker, Mrs. Maria Nalbandian, the Acting Director General of CAS. Mrs. Nalbandian leads national efforts in the collection, analysis, and dissemination of official statistics and plays a key role in strengthening Lebanon's statistical capacity and promoting data-driven policymaking. Her leadership focuses on fostering institutional partnerships, transparency, and innovation in national data systems. She also serves as the head of the Legislation and Tax Policies Division in the VAT Directorate at the Ministry of Finance. We're also pleased to welcome all the CAS member teams who joined us today for this important session showcasing their work. Today's seminar will provide really an overview of CAS's mandate, strategic priorities, and ongoing initiatives, along with opportunities for collaboration with AUB in research, data development, and capacity building. We also welcome all our online attendees. So the session will consist, as usual, of about a 40-minute presentation, followed by Q&A. And our colleagues joining online are also invited to type their questions on the chat, and we will read them during the Q&A. So with that, please join me in welcoming Mrs. Nalbandian.
Good morning, everyone. Thank you for hosting us in AUB today. It's a pleasure to speak today at the American University of Beirut about Lebanon's National Statistical Institution, Central Administration of Statistics, CAS. Today I'll tell you about CAS, its structure, its work in producing official statistics, the challenges we face, and how we collaborate with other institutions, with universities, such as AUB. By the end of this presentation, I hope you'll have a clear understanding about how statistics underpin policy, research, and national planning in Lebanon. The Central Administration of Statistics, known as CAS, operates under the presidency of the Council of Ministers, which means the Prime Minister is our director. It is the only national authority in Lebanon responsible for official statistics. Our mandate is to collect, process, produce, and disseminate social and economic statistics. CAS was established under the law number 1793, the year 1979. For over more than 40 years, 4 decades, CAS has been the reference point for credible data on Lebanon's economy and society. The law that creates CAS not only defines our mandate, it also guarantees the confidentiality of the information, especially individual information, a principle that helps us to earn public trust. In a country like ours, where reliable information is vital for recovery and reform, this role is more critical than ever. Next slide, Tamara. Our mission is to collect, process, produce, and publish official statistics, to ensure that government decisions are supported by solid evidence, to technically supervise statistical work in other ministries, and to harmonize methods across institutions so data can be compared over time. Our vision is to produce statistics, accurate statistics, relevant and internationally comparable, while respecting the UN fundamental principles of official statistics. This vision ensures that Lebanon data meet global standards while serving local needs. Next. As I just said, CAS operates under the presidency of the Council of Ministers. And CAS is led by the Director General, who oversees all statistical and strategic operations. Our structure includes departments that cover the full cycle of statistical production. We have the Household and Social Statistics Department, responsible for social surveys. We have the National Accounts Department, which handles national economic indicators. We have the Production Statistics Department, which covers administrative and sectoral data. We have the IT Department, which support digital systems and data management. The Field Operations and Regional Statistics Unit manages data collection across the country, ensuring national coverage. The Administrative Department supports all the internal operations. And finally, the Documentation, Printing, and Publication Unit ensures that all our outputs, like reports, publications, and data, are properly disseminated. The structure ensures efficiency, coordination, and a clear vision of responsibilities across all statistical domains in Lebanon. The key departments and their functions. The Administrative Statistics Department, we have four main groups: administrative, population and social, economic, and the national accounts. The administrative collects data from other ministries and institutions on a wide range of sectors, such as construction, energy, agriculture, environment, transport, tourism, industry, and telecommunication. These data sets form the backbone of sectoral indicators and are used for policy and planning. The second one, Population and Social Conditions Department, focuses on people and households. It monitors children's welfare, education indicators, gender statistics, health metrics, labor market, income distribution, and household expenditure. This department provides essential social indicators for national development and for the international reporting, such as SDGs. The third one is the Economic Statistics Department. Produces some of the most widely used indicators, including the Consumer Price Index, CPI, Construction Cost Index, CCI, and contributes to the International Comparison Program, ICP, which allows Lebanon to compare its economic performance globally. And the last one is the National Accounts Department, compiles annual and quarterly national accounts, including GDP, economic growth, income, consumption, and trade balance indicators. These outputs follow the international framework of the System of National Account 2008 and are essential for economic and fiscal policy. Together, these four departments ensure that CAS provides a complete and coherent statistical system that covers social, economic, and sectoral dimensions. Next. For the administrative data collection, CAS coordinates with other public administrations. For instance, crime statistics from the Ministry of Interior, education data from the Ministry of Education, energy data from the Ministry of Energy and Water. This system covers around a dozen sectors, including tourism, agriculture, trade, and telecommunication. And to ensure quality, CAS applies strict standards of timeliness, reliability, and adequacy. We rely on a network of focal points in each ministry, specialists who validate the data before it reaches us. This cooperation allows CAS to integrate multiple data sources and maintain consistency across the national statistical system. The challenges, next one. The challenges and solutions. Like most of the public institutions, we face several challenges. First, the data confidentiality restrictions. Sometimes it limits our access to administrative sources, particularly from the Ministry of Finance. Second, non-digitalized processes make data collection time-consuming and prone to error. Third, bureaucratic procedures can slow the exchange of information. And fourth, human resource shortage affect both field work and technical analysis. And to address these issues, CAS is implementing a digital transformation strategy, introducing electronic data collection tools and cloud-based storage. We are also strengthening formal cooperation agreements with ministries, modernizing procedures, and continuously training our staff. Another priority is to enhance statistical literacy to raise awareness of how important good data are for Lebanon's development. For the economic, next one. For the economic statistics, CAS is the economic statistics are one of CAS's core pillars. Through our price indices and national accounts, we provide the numbers that shape monetary, fiscal, and investment decisions in the country. For example, when you read about the inflation rate or GDP, or that the GDP grew, those figures originate from CAS, from the National Accounts Department. Our economic data are also used by the World Bank, by IMF, and by other researchers around the world to understand Lebanon's economic performance. Next one. For the Consumer Price Index, CPI, the CPI measures how the prices of a representative basket of goods and services change over time. It is Lebanon's main indicator of inflation, the CPI. The CPI also affects wage negotiations, pension adjustments, and contract indexation, and it also serves as a GDP deflator in economic analysis. CAS collects price data from hundreds of outlets across the country and complements this with administrative sources and web scraping techniques for online prices. And by combining traditional and digital methods, we ensure that the CPI reflects real-world price dynamics. Next slide. For the CCI, the Construction Cost Index, and the ICP, International Comparison Program, the CPI is new for Lebanon. It is the first time that CAS put this index. It's the first time, is relatively new for Lebanon, the CCI. It tracks changes in the cost of materials and labor and equipment, which helps both public planners and private developers. This index is particularly important today, given the change in prices in construction materials due to currency fluctuations. CAS is going to launch this index before the end of the year, we hope. If not, at early 2026, we will launch it. For the ICP, CAS participates in the International Comparison Program, ICP, coordinated by the World Bank and the UN ESCWA. The ICP allows countries to compare the real purchasing power of their currencies by calculating purchasing power parities. Our collaboration with the IMF and ESCWA ensures Lebanon's indicators are aligned with international standards. For the national accounts, is one of the most important departments in CAS. The national accounts summarize the entire economic activity of the country. We compile annual and quarterly estimates of GDP, national income, consumption, investment, and trade balances. Our methodology follows the system of National Account 2008, the global framework recommended by the UN and the IMF. These data are essential for designing fiscal policy, assessing economic growth, and comparing Lebanon with other economies. Currently, we're finalizing updates estimates through a technical assistance mission with UNDP to ensure full coverage and transparency. And we hope also to put in your hand the 2024 national accounts also before the end of the year. For the social statistics, beyond the economics, CAS dedicates great effort to social statistics. We collect information on population structure, education, health, expenditure, and income data. Our surveys, such as the HBS Household Budget Survey and the Labor Force Survey, allow policymakers to understand issues like poverty, like unemployment and inequality. District level statistics are particularly valuable for local development programs and NGOs working in different regions of Lebanon. Now we start a new HBS for the 2026, for the next year. I hope we'll finalize it at the end of 2026. And it includes several indicators about the labor force, poverty, and other indicators. World Bank and other international organization assist us with this HPS. Now we finalize the questionnaire and we are going to sign the MOU, and we hope starting 2026 we can begin the field operations. For the mixed surveys that we will launch tomorrow, the result of the 2023 at the Grand Serai. One of our flagship projects is the mixed multiple indicator cluster survey, carried out in partnership with UNICEF. This survey provides internationally comparable indicators on women health, children's health, education, living conditions, and it directly supports monitoring of the Sustainable Development Goals, SDGs. The last mix round in 2023 covered sub-national level with data collected from more than 7,000 households. Such large-scale data allow Lebanon to benchmark its progress and identify vulnerable groups in need of policy attention. For the health indicators, next slide. Yes. We have some examples. Maternal mortality data show, for example, that deaths related to pregnancy are about 4 times higher among non-Lebanese women than among Lebanese. This difference reflects disparities in access to healthcare and economic conditions. We also found that only about half of women aged between 15 and 49 years use modern contraceptive methods, while 9% rely on traditional methods. Insights that inform public health and family planning programs. These examples show how data turn into actionable knowledge for ministries and humanitarian partners. For the gender statistics, are another priority area. Our publication in 2021, The Life of Women and Men in Lebanon, produced with UNDP, compiles data from 2004 till 2020 and paints a detailed picture of gender gaps in employment, education, and decision-making. We are now working with UN Women and UNICEF on a new analytical gender report. And by integrating in gender and disability data across surveys, CAS contributes to the principle of leaving no one behind, which lies at the heart of the 2030 Agenda for Sustainable Development. What are the major surveys conducted by CAS? Over the years, CAS has carried out a wide range of large-scale surveys. The population and the housing census in Palestinian camps in 2017. The labor force and household living conditions survey in 2018-2019. The child labor survey in 2015. And the census of buildings and establishments in 2004. Our next major cooperation that I just said, will be the Household Budget Survey 2026, which will update expenditure and poverty data. Each of these surveys forms part of a long-term statistical series that allows trend analysis over decades. About the publication and data services, all our data are made accessible through publications such as Statistics in Focus, monthly CPI bulletins, and downloaded time series datasets. Our website, www.cas.gov.lb, provides free access to most indicators. This open data policy promotes transparency and enables students, researchers, and policymakers to use the data directly in their work. And we strongly encourage AUB students to explore our website. We will have a new one before the end of the year also. So we encourage AUB students to explore our website and datasets for their research projects. For the international cooperation, CAS maintain active partnerships with international organizations, including UNESCO, UNDP, ILO, UNICEF, UNFPA, IMF, and the World Bank. Through these collaborations, our staff receive training, technical advice, financial support for surveys. We also participate in regional workshops and roundtables that help harmonize methodologies across Arab countries and improving comparability of data. About the CAS and the MedStat 5 program. Yes. One major collaboration is the MedStat 5 program funded by the European Union. It promotes exchange of expertise between Eurostat and the countries of the Southern Mediterranean. The program focuses on 6 thematic areas, including gender and employment, energy and environment, migrations, and 5 horizontal themes such as IT, human resources, and quality management. By participating, CAS not only benefits from EU experience, but also contribute to shaping regional statistical cooperation. About the collaboration opportunities with AUB. There are many potential areas of collaboration with AUB. Joint research using data, student internships, guest lectures by CAS experts, and co-authored publications that bridge academic rigor and official statistics. We also see opportunities for developing statistical applications and tools that make data more accessible. And through this partnership, students gain hands-on experience with CAS benefits from fresh analytical perspective. And last one, I think, the importance of academic research. They provide reliable, nationally representative information covering decades of Lebanon's social and economic development. Time series data help track trends. District-level data enable spatial analysis, and gender disaggregator indicators support equality research. using CAS data ensure that academic studies are grounded in facts and can effectively inform public debate and policy making. This is why collaboration between CAS and universities like AUB is so valuable. It transforms statistics into insight and evidence into impact. And to conclude, the Central Administration of Statistics remains Lebanon's official and trusted source of data, committed to accuracy, transparency, and service to the public good. Reliable statistics are essential for rebuilding trust in institutions, guiding economic reform, and achieving sustainable development. We look forward to continued cooperation with AUB and to engaging the next generation of researchers in shaping Lebanon's data future. Thank you for your attention. If you want, we can open the floor for questions and answers. I want to ask my colleagues here to answer the questions accordingly to their area of expertise.
Yes.
Thank you so much.
Thank you. Thank you very much, Mrs. Nalbandian, for providing us with an opportunity to learn more about the national data system. It's very exciting for us at AUB. We have a lot of students also in today here, and I'm sure they got also excited about what you have presented. يعطيكم العافية. You have a lot of work to do by the end of the year, as you said. I hope you'll be able to. عطلت همكم يعني. Okay. So we're going to open the floor for discussion. We're going to take questions from the audience, and also I'm going to alternate between the online audience and we have Dr. Adib.
Thank you. Good morning, Mrs. Nalbandian, and allow me to tell you how happy we are that you and your crew are actually here today. My name is Salim Adib. I'm a professor of public health here at the Faculty of Health Sciences. We are in dire need of having a connection with the CAS because all the work that we do has to be indicated based on the baseline, of which the most basic is what is the population of Lebanon. I deal with cancer statistics, and I can tell you that our data has become so invalid that some centers outside Lebanon are creating for us cancer data that do not reflect the reality of this country, rather than counting on the data that we would be willing to present because of the inconsistencies that is happening with the database in Lebanon. During the years that followed the civil war, we've had a very rich connection with the CAS under the Kasparians, and we actually collaborated in most of the first line surveys that happened during the first years immediately in the 1990s. And then things started getting a bit more complicated. I think this was the period when you lost most of your staff. And those big books that used to come out that would tell about everything statistical in Lebanon also disappeared. It was a bad period for all of us in Lebanon, and certainly for CAS also. So we're looking forward to a renewed activity and our capacity of working with you and profiting from the kind of resources that you actually have, being the government agency that deals with statistics. In particular, it's very important for us that we have some demographic data that is consistent. In the past 20 years, I'm sure you must have noticed, we have had ups and downs of estimations of what the population is in Lebanon, which meant that our cancer incidence was one day up and one day down. We're a republic where, unlike everywhere else, our incidence goes up and down, and whereas everywhere else the incidence of cancer is just going up, which is, so I'm looking forward to, and maybe you can tell us how can we rebuild our connections with you and build up a consistent research around what is the population of Lebanon, in particular on de-aggregated data. And it's interesting to have indicators varying from year to year that comes from Lebanon and not from, somewhere else, God knows what. But at some point, we need also to analyze the individual values. And I know that confidentiality does not allow this, but for example, at the Ministry of Public Health now, there's a work to start using a unique identifier for everyone coming in. That would allow us for the first time in Lebanon to calculate a survival rate for cancer. We don't know. Once you get diagnosed with cancer, what is the average survival for you? Because we don't have the end. And now we're going to be able, I hope, next year to be able to link these things. So I think that there is a lot of collaboration and putting things together through the Ministry of Public Health, through us, through you. And I look forward to having a more consistent demographic denominators that we can use. Thank you.
Thank you. Thank you. Anan, can you tell Dr. Letter about what we have done with UNFPA, please?
But that's you.
The last one, the last work.
Good morning. Since we don't have population data since 1932, and only we have the population estimation from the census we have made at 2004, so we don't have estimation for population. We, with the UNFPA and ESQA, started a project that they executed in many countries, which is making estimation of the population using GIS data and geospatial data. So this, okay. So this project, hope that will be on the road in the few months ahead.
Yes, can I add something? I'm working now at economic statistics, but regarding accurate measure of an estimation of the population in Lebanon. So we do have some estimation because every survey we conduct from household, we calculate a measure, an estimation of the population in Lebanon. And if you can read what we have done so far from 2019, we have the labor force in 2021, and now we will also conduct a survey from the household. So we have an estimation of the number of population in Lebanon, but of course we don't have the exact number because we, as CAS, we don't have the mandate to run or to conduct the census of population, and every one of us knows why. So, we are waiting for the next, yes. We will do. Yes, we are happy to do it starting from tomorrow, if we give the permission to do it, even without mentioning any religion, or we just want to count the number of population who are living in Lebanon. Yes, but it's not a CAS it's a political issue, but we do have some estimation, maybe from the program that Hanan mentioned, we can have a better estimation based on. But I will tell you the formula, how do we estimate the population in Lebanon. We know that the average size of household in Lebanon, if you multiply it by the number of household, so you can have an estimation. Of course, any statistics has a range, let's say, confidence level or margin of error. So if we try at CAS to minimize this margin of error to have a better estimate of the population. Our numbers are different from the world population because they count also the Syrian or the Palestinian everywhere. I don't know how they do it, but it's different from CAS numbers.
Thank you so much. I'm gonna, yes, can I take just one question from the online and then back to you? Thank you. So Dr. Nway is asking if the survey tools, the questionnaires, and the research protocols in terms of methodology are publicly available. If the questionnaires, this one. If the questionnaires and the protocols in terms of methodology are also available for these surveys that you have conducted before.
Are they available publicly?
Yes, but because I was working with the social statistics, our team is small, so we work all together. We are a small team. So we have in each publication the result. We have the result of the survey and the methodology, the sample size, sampling error, everything, and the questionnaire at the end of the survey. Yes, we have everything inside.
And I think just a follow-up.
Thank you so much for a very comprehensive and exciting presentation. My name is Lilian Ghandour. I am a professor of epidemiology and the chair of the Department of Epidemiology and Biostatistics. And it's an absolute pleasure to have you and your team with us today. And I'm so excited to see some of the students as well, despite the end-of-year deliverables that they have. So they've made an effort to come here. The last two slides for me were music to my ears. You know, the part about working together and maybe our students, you know, finding, you know, right, within a certain structure and protocol, having our students work with your data. And so maybe just in addition to this, a few points about maybe like your mandate or your policy and process for data access and sharing. I'm not talking about the ones that have been analyzed in the reports. So if, for example, one of our students, MS or PhD, would like to access the data and work with you and your team on maybe analyzing an important research question, what is the process for the data access and sharing? Thank you.
The raw data. We cannot benefit as much from aggregate data, so we need raw data, individual-based data for.
What's the policy?
What's the policy?
In each case, we'll see what we can give the students. The raw data is confidential. So in each case, we can study and what we can give
Case by case.
case by case.
Yeah, in general, the raw data is confidential, but students can come to CAS offices, work with us, see the data if they are next to our colleagues, etc. We can see case by case. So we can receive any requests from AUB, and then we can respond to this accordingly.
And you have a policy that the data.
Yeah, the data is confidential. Yeah.
You cannot upload it on your personal computer.
Raw data.
There should be some kind. I'm talking about a policy about whether you can upload on your personal devices, or maybe it's like some centers here, you have to go to the center itself and work on it. But this can be actually solved if you have some virtual machine where people can access and yet not be able to upload on their personal data. And this is something. Until now, we don't have.
You want to add something before I take the question? Thank you for your patience.
Yes, sorry, one second. We have already raw data published at CAS website. So the last survey we conducted, we have put online the raw data. Of course, the data as we remove anything that de-identified, and so you can use it already and make the labor force survey, I guess. It's raw data. It's an individual data.
Please, but no, there is the. No, I want to take that question.
Thank you. This is really super interesting presentation. I'm Ms. Diwan from the Department of Economics, and also we are in very large demand for your data. And so we would, we're available to work closely with you. We have, several specialists that could help you in statistics, in econometrics, also that have experience with using raw data if you want to develop your policy more carefully. I wonder if you could tell us a little bit about the next few years for CAS as you see them today. I mean, obviously, we just went through very difficult years, and you're trying to catch up. And to what extent do you feel that your budget, your staffing, your mandate is allowing you to catch up? I mean, there's a big backlog. For example, you haven't done a labor force survey for a while. You're catching up with the national accounts. But there is a controversy. I mean, some people say 20, some 30, some 40. I mean, there are big differences. So methodologically, how comfortable are you with your tools? I mean, to what extent can we have representative surveys without a sample? That's a constraint. How do methodologically you deal with this? Or we know some regions, it's more difficult perhaps to do some surveys there. So I mean, it's important to know the constraints and to know what the data is exactly telling you. These are some of my questions. And again, we're very happy to work closely with you as needed.
Okay. Mainly, thank you for your question. As an economist in the National Accounts Department, we published the 2023 GDP recently, and we're working on the 2024 GDP. We will publish it in early December, with some revisions, of course, because it's in all countries like this, we always publish revisions of the previous years. How much we are confident with our methodology? We work very closely with IMF experts and with UNDP experts. And we follow the SNA 2008 methodology. So our methodology is very approved from the International Monetary Fund, which is the main institution responsible of national accounts in all worldwide. This is for national accounts. For our social surveys, they are ad hoc, so we don't have a time series for all years. And this is a problem for CAS, because we have a lack of human resources, but mainly of financial resources. So our surveys are funded by UN institutions always, not by the Lebanese Republic. So this is a problem that the solution is not very easy to find. Maybe we can also cooperate with AUB regarding the human resources, because in our surveys we need a lot of enumerators, and maybe AUB students also can help in this issue. So there are many domains where we can cooperate together.
Yes. Is it a follow-up question? I have Dr. Kabakian, and then we'll take.
Thank you for the presentation, very informative. And my question is similar to my colleague's question online, Khalil. And we're both asking about the mixed data, because we analyze mixed data of other countries that are available publicly. I mean, or you can have access with minimal, formalities of approval. Yeah, but the question is about the raw data that you can do secondary and further analysis, because, I mean, as a person working in maternal health, reproductive health, this is really interesting to be able to dive deeply into data from Lebanon. And I mean, the graph you showed on maternal mortality ratios is something I worked on with my colleagues from aggregate data from the Ministry of Health. And I mean, we have many more questions and seeking answers to, but if you don't have access to the raw data, it would be really difficult to. But with mixed and similar DHS data, they're usually mostly, public, available, and, researchers from different countries can have access to. Thank you.
Some institutions will actually participate in secondary analysis of the raw data. And it's really a shame that data that has been collected with so much resources and so much techniques would be analyzed once and then not extracted further. And we that to be very important for us that we can extract some data. Let's talk about it.
Okay. And
needed يعني. We are going to publish all the indicators, all the results. Okay, about the raw data, we'll see. We'll see.
okay, any other questions from the audience? I think Dr. Nouahed is asking about if there are any data collected on the environment and agriculture, and when was the latest survey conducted on environment and agriculture? Nadine.
Hello, Dr. Nouahed. It's Nadine. Currently, we rely on data provided by the Ministry of Environment and the Ministry of Agriculture, because CAS, till now, didn't conduct any environmental survey. So we didn't conduct an environmental survey.
Thank you, Nadine. Dr. Makhoul.
Thank you very much. Ahla sahla fikum, and thank you very much for this very, very interesting talk. I wanted to ask 5 questions, but I'll limit to 3 or 2. I would like to know about the work that you do, the kind of data. So it's quantitative data, definitely, but is it all primary data collection? Do you rely on extrapolation of statistics information that you already have the data, or is it always primary? You collect data that's very much based on empirical research. Is that all of the time? Or do you have information that you can extrapolate or extend for predictions for the next 2 or 3 years? But also, how do you decide on what questions to ask? Yes, we get, you get requests from the Ministry of Environment, Ministry of Agriculture, but are there certain questions that probably you feel that you want to ask, but you cannot ask, or what kind of data you think is missing? And how can we help you identify data that are missing or questions that needed to be asked? Based on our research in public health, there are a lot of issues that people really don't talk about that are very, very important, that are very much impacting people's lives and beyond, the vital statistics that you have. So how do you decide, and is there any way that we can infiltrate the decision-making to prioritize some questions that are important? And last question is, what do you want from us?
So since I'm answering 2 questions, I will answer the 2 questions that you did ask. I'm sorry, I'm joking. So we do primary collection. We don't do extrapolation or interpolation. Our mandate as a National Statistic Office is to conduct surveys, censuses, and provide quantitative data from the field. So this first question. The second question, what we do for social statistics, usually we have a standard questionnaire that most of the countries are using as a standard, and we trick it to a Lebanon like language. Using the language, we can remove some of the questions which are not valid for Lebanon, or we add questions. But also, because this is like the mix is multi-purpose survey, so we have a lot of components, modules inside. So for specific, what you mentioned is more about specific dedicated questionnaire for health or for. So we can do this with AUB if they are. We can do it. Why not? We are too specific. Yes, add more questions. Usually, usually we ask stakeholders if they would like to add some questions. This is what our methodology is, how we work. But because the questionnaire is already big, so we don't. Yes, it is. But as I said, we are happy to work with them on specialized questionnaire and survey. Why not in the future?
Thank you very much. If there are no more questions, then I think we can close. Thank you so much. The Queen.
That requires another. It's another
We can begin with, I don't know, signing an agreement with you to earn from your expertise in this area. AUB can send students. They can help us in the field surveys or in the office calculation of
Data analysis.
CPI, ICP, interpretation of, I don't know, we can talk about all specific surveys. We can talk about all your needs and our needs. And we are going to have a meeting now with you, and we can discuss all the...
Yes, this seminar, yes, he's going to join our meeting. So we have actually, so this seminar was meant to be really to understand more about the mechanisms, the data, the availability of data, and to be a starting point for a conversation where we sit together at the table and we discuss in detail what we can offer the CAS and what the CAS can offer us. And so we're going to actually start a conversation right away.
We signed last week with the Beirut Arab University, and we are going to sign with the Lebanese University, LAU and Lebanon.
And inshallah, AUB. Of course, we have Dr. Aal with us today, and we're going to now have a closed meeting, inshallah, to discuss some of the practical steps towards these partnerships, which are very important. Thank you, everyone, for engaging with us, and see you next semester.